Hello everyone, again this is Dr. Famous Favor. I'm just gonna do a quick rapid review on just pharmacology essentials. I have a lot of other pharmacology videos. You can scroll down and see some other videos, but just a quick rapid review of just some of the things you need to remember for your exam. So let's talk about AC inhibitors. For AC inhibitors, we know that we use it for the treatment of hypertension. So what is the major side effects to monitor? Dry cough and hyperkalemia. Remember, dry cough and hyperkalemia. And ACs and ARBs, they are all contraindicated in pregnancy. So when a patient is on ACs and patient develop the dry cough or patient develop angioedema, you are going to switch it over to ARBs. But just remember, ACs inhibitors, the side effect is dry cough, angioedema, and hyperkalemia, and is contraindicated in pregnancy. So we use ARBs when the patient develop side effects to ACs inhibitors. So please always remember that. So we have our thiazide. Thiazide diuretics is always the first line, and you have to watch for hypokalemia, hyponatremia, hyperuricemia, and also regarding statins, you are going to monitor the risk for myopathy and which rhabdomyolysis, and it also requires a periodic liver monitoring the liver functioning. So regarding metformin, it has is the first line treatment for type 2 diabetes. You have to monitor GI upset like nausea, vomiting, diarrhea, and there's always a risk of lactic acidosis. In patients with renal impairment. For sulfonylurea, it stimulates insulin release independent of glucose. So you have to primarily monitor the risk of hypoglycemia. For beta blocker is also a medication for hypertension. It can mask hypoglycemia. Beta blocker can mask hypoglycemia, so you have to use it with caution for patient that is diabetic, and also you use it with caution for people that are asthmatic, because it can cause a risk of bronchospasm. Also for macrolides can cause the risk of QT prolongation, so you have to screen for ECG in patient that has a higher risk. So in summary, for ACs and ARBs, you have to avoid it, or it's contraindicated for patients that are pregnant. And also for tetracycline is contraindicated for patients that are pregnant, because it can also cause the staining of the teeth for the newborn. And also for fluoroquinolones, it can cause Achilles tendon, so avoid it in children and pregnant mothers. So let's just do quick questions to wrap up what we have talked about. A 58-year-old man with hypertension and type 2 diabetes is started on lisinopril. 2 weeks later, he returns complaining of a persistent dry cough. The buzzword, persistent dry cough. So patient returned with a persistent dry cough. Which of the following persistent dry cough, which of the following, okay, a 32-year-old woman with community acquired pneumonia is prescribed azithromycin. Her past medical history is significant for a known prolonged QT interval. Which of the following best explains the primary concern with this prescription? So if you remember what we talked about azithromycin, so the option of QT prolongation and torsades de pointe, that is the major risk. So always remember that patients that are on azithromycin is also known as macrolide, they are at a risk of prolonged QT interval. A 55-year-old male marathon runner is prescribed ciprofloxacin for urinary tract infection. 3 days into the therapy, he developed Achilles tendon rupture, Achilles tendon pain without trauma. Which drug class is most responsible? So which drug class is most responsible for causing Achilles tendon pain? So if you choose fluoroquinolones, and you know that ciprofloxacin is an example of fluoroquinolones. And other fluoroquinolones are what? Gemifloxacin, moxifloxacin, ciprofloxacin, and levofloxacin. So always know your fluoroquinolones. And those fluoroquinolones, it causes Achilles tendon rupture or Achilles tendon pain. A 26-year-old woman in the first trimester of pregnancy is found to have a new onset of hypertension and proteinuria. Her physician considered starting her on antihypertensive therapy. Which of the following agent is absolutely contraindicated? So it's just asking you what medication is absolutely contraindicated in patient that is pregnant, and this patient is first trimester of pregnancy. So the answer is what? Enalapril. So enalapril is your what? AC inhibitor. The rest of the medication there, labetalol, methyldopa, nifedipine, they are all safe in pregnancy. And remember, in summary, ACE inhibitors, they cause cough. Macrolide, they cause QT prolongation. Fluoroquinolones, they cause tendon rupture. And beta blockers, they can also mask hypoglycemia.